Good evening, everyone, and thank you very much for joining us for tonight's meeting of the Hammersmith and Fulham Public Services Reform Policy and Accountability Committee. My name is Councillor Rowan Ree, and I am the chair of the committee. This meeting is being held informally, so we can continue to meet remotely while COVID remains a serious public health risk in the borough. I'd like to remind all participants of a few housekeeping points. Please keep your microphones muted unless you're speaking. Please wait until I call on you before speaking. And please can officers introduce themselves when they first address the committee. The first item on the agenda is apologies for absence. I've received two apologies this evening, one from Councillor Zarar and one from Adam Connell, the Cabinet Member for Public Services Reform. Although we aren't being shortchanged tonight because we are very lucky to have Councillors Max Schmid and Councillors Ben Coleman joining us to talk to two of the reports this evening. So the second item on the agenda is declarations of interest. I'll go through the committee and give people a chance to introduce themselves and also just to note whether they have any interests to declare. So firstly, Councillor Cooper.
Yes, I'm Councillor Cooper, Councillor for Fulham Reach. No, I have no interest to declare.
Councillor Stanton.
Good evening, everybody. Yes, I'm Councillor Dominic Stanton, Councillor for Munster Ward, and I have no declarations to declare.
And Councillor Vincent.
Good evening, Chair. Yes, Councillor Vincent, Fulham Reach, and I have no interest.
Excellent, thank you very much. The next item is the minutes. So the minutes are from the previous meeting held on the 7th of April 2021. Now we are just noting these minutes, although I suppose if anyone can spot any glaring inaccuracies, now's the time to point them out. Does anyone have anything they'd like to raise from the minutes? In which case we can informally note those and then move on to item 4 on public participation. We've received no public questions ahead of this meeting, so we can skip on to the main business, or the start of the main business for tonight's meeting. And this is a report on COVID-19 1 year on. So we did have a meeting about the work that the council was doing to tackle the pandemic a year ago this month. So now is a good time, I think, for us to take another look and have an update and see what's been going on and see all the good work that's been happening. So I'm going to hand over now to Linda Jackson to introduce this item. Over to you, Linda.
Thank you, Councillor. Thank you, everybody. My name's Linda Jackson. I'm the Director of COVID-19 for the Council. I'm going to take it that the report has been read, if I may, but just to highlight a couple of things. Just to say, it's 12 months since we've been back, and never before has anything shone a torch on health inequalities as this pandemic has. We're still in the pandemic. We are still in wave 3 of the pandemic now. It has not gone away. Our current case rate is 549.3, so we're the 3rd highest in London, and it's slightly plateauing, but I don't want people to think that because lockdown has lifted that everything needs to go back to normal, because that is not the case. However, what we do know is that those most deprived in our neighbourhoods were the people that were hardest hit throughout this pandemic. Those people who are Black, Afro-Caribbean people have also been the hardest hit. But it's not just been about Black, Afro-Caribbean, it has been about deprivation, it's been about social isolation, and loneliness has been a key factor to people suffering throughout this pandemic. What we have done, and we've taken lots of learning through this pandemic, and we've taken the data and we've used that to build on and sharing our learning. So we know that we had a low uptake of flu vaccination, which is something that the NHS are responsible for delivering, but we've been low on flu vaccination for a number of years. We've used that learning and we've used that data to be able to target communities in deprived areas. So we've done that by setting up vaccination clinics, pop-up buzzes throughout the campaign, and that's been really good at targeting people. We've done over 50 contact points with different parts of the community, either evenings, weekends, faith forums, different community groups, led by different people, different age groups. And what people have told us, and I know it's something that Councillor Coleman will want to touch on, is there are a number of big issues that we've got to learn, not just now, but in the future. There's a big issue about trust. There's a massive issue about people not trusting, not just the council, but the NHS. They don't trust the government. They don't trust industry and business. People are saying, you've not wanted to bother with us for now. Why now do you want to come and talk to us? So that's something that we've taken forward as a big learning point. There's big issues on racism still outstanding that we've got to tackle, on deprivation, on housing is a massive area that we've also got to tackle. And we've been tasked by Councillor Coleman to work on the learning from COVID and build up a really robust health and wellbeing strategy for the borough, not just for the council, but for the borough. And that's something that we're working on now. We've identified throughout all this report that each of the departments has been hit in different ways, and we've seen some real strengths come out in different ways. Certainly the wraparound of the residential units was absolutely immense in saving people's lives. The development of the CAN Contact Centre remains the forefront of the front door for adult social care, and we'll build on that for the rest of the council. The work that Children's Services did on getting young people access to IT equipment and Wi-Fi, 792 laptops were actually given to young people and children and families who would not have been able to access information and schooling without it. Unemployment's risen massively, and we've seen that, and the impact with almost 42 million spent on businesses to support businesses alone, with about 176,000 on hardship grants. Now that doesn't seem quite enough when you say 42 million for businesses, but the hardship grants is for those very, very deprived families. We've also done lots of work through our winter wellbeing campaign as well, where we've given free school meals to children and families, the development of the food bank. And also you'll note in the report that the environmental impact, the reduction in nitrogen dioxide concentration in Hammersmith Town Centre and Shepherd's Bush air quality monitoring sites. And we need to learn from that and look at how can we maintain that and build that into our recovery programme as well, particularly in the more deprived communities. So you can see there's a constant message coming through about working closer in communities, in deprived communities, and building up trust. Our employees, we never thought 12 months ago that we'd receive the number of employees working from home. It's been absolutely fantastic. And we're now on our, I think it's the third ways of working guide, which has been developed with TTI and through conversations with our staff about how we can further support staff to work flexibly, work remotely. And we're building on that and bridging our knowledge around that, around the civic campus, and how we can look further in the future, building better and bigger and better. We are looking at a plan for us to look at pilot schemes for ways of working from August, September this year. But clearly the message has got to be that we will still remain a council that's remote working. Given our figures that we've got at the moment, the high rise, we cannot sit back, we cannot think that this pandemic has gone away, because it's far from gone away. We've got to keep the messages going about how we protect people, how we protect our current shielded people, because people are still afraid, but also how we learn and build on the good work that we've done already, and with lots and lots to build on and be proud of. about how we've used technology, how staff have come together. Never once has any member of staff in this council said, that's not in my job to do that. It's not my job description. People are open and saying, tell me what you want and we'll help you. So I think we've an awful lot to be proud of. We've still a long way to go. And we've still lots of lessons to learn for in the future, but they are good foundations for us to build on. If I may, Chair, I'll hand over to Councillor Coleman if he wishes to add anything.
Right. I wasn't necessarily going to anything at this stage, but I was going to take perhaps add some things when it comes to questions. But I will, Chair, if you're happy, just take up Linda's invitation on one very specific thing which she's touched on, which is we are, as you know, a number of people in the borough are still reluctant to get vaccinated. And the reluctance is, and we've done a lot of number crunching on this, and a lot of looking at the data by ethnicity and by socioeconomic background, by deprivation, and by age. And the two groups of residents which are most reluctant to get vaccinated or haven't got vaccinated are people of Caribbean origin, African origin. And this has been a really, as Linda touched on, a really shocking and eye-opening thing for well, me, as long as everybody else. I think, you know, you've got a room here of largely white, liberal-minded, no matter what party they're from, men who think that things are improving when it comes to racism in our society. And then when you realise that there are so many people who don't have enough confidence, who are from and this is partly going on anecdotal evidence, who just don't have enough confidence and need trust in the NHS, that when they say a vaccine, when the NHS says a vaccine is good for you, it's the only way out of this fight, this nightmare that we find ourselves in, they still don't trust it. And a couple of anecdotal examples is our chief executive, who, that's our black, was leaving an event a few months ago, bumped into a black nurse. Nurse said she wasn't taking the vaccine. And why not? Well, there'll be 3 vaccines and they'll give the worst one to black people. That's what they always do. Or our mayor, former mayor, who's retired now, from Nigeria originally, many years ago, and we're talking to one of her friends, older gentleman retired, and she said, I'm not taking the vaccine. Why not? Well, they've been trying to kill us off for so many years, they're finally going to manage to do it now. Now, there are lots and lots of these stories that I'm hearing, although not as many as I should be hearing if I was talking to more people. And it doesn't say, I'm not saying that these people, what this doesn't say is for us to go, oh, these people, how can they be saying these things? I think we have to say, these people, how can they be saying these things after so many years of being equal citizens, as it should be, equal citizens in our country? And I think one of the things that the pandemic has thrown up and the vaccine reluctance has thrown up is that there is still a major issue of perceived racism when it comes to many parts of the country, society, and the NHS, which is truly shocking for those of us who hold the NHS in the highest esteem, and what it says is really what goes usually. So one of the challenges facing us is, how do we rebuild trust? How do we rebuild confidence? And as Linda said, we're starting to work on that. The good news is that in the integrated care system, which you may or may not be aware of, is the coming together of the 8 boroughs, 8 health systems, 8 clinical commissioning groups of GPs and hospitals in northwest London, which we're one of, Hammersmith and Fulham, Kensington, Chelsea, Westminster, Hounslow, Harrow and others. They have agreed that racism is an issue, not just inequalities. Inequalities is huge and important. It covers racism, it covers issues of disability, which are hugely important to this council, as you know. But not just talking about inequalities, but actually talking about how we can address issues of racism and perceived racism, and how we can work directly with communities to shape the health services that they receive in a way which gives them confidence for the future. So that's perhaps a slightly tangential thing that you didn't expect perhaps me to come, and Linda raised, I think, very helpfully in her report. You didn't perhaps normally expect to come out of a COVID report, but I think if we're genuinely talking about the learning, and the word learning, or we've got to learn from this, or we've got to do the learning from that, and very often learning is spoken about, but not really done. If we really got to learn something from this crisis, this is one of the things that we have to learn from, and that's how we engage with people, particularly Black people from Caribbean African backgrounds, so that they become part of the community that shapes the health services they receive and have a confidence in the system, which I think at the moment is lacking. But that's what I'll say for now. Maybe some questions you want to ask.
Thank you very much, both. Thank you, Linda. Thank you, Ben. This is a very big issue. Lots of very big, meaty issues for us to tackle. And Councillor Coleman, that's another very big one that you pointed out. That you rightly say, perhaps when you sit down to a meeting about a global pandemic, perhaps that's not one of the things that instantly comes to mind. But it's really good that that we're capturing all these extra risks that come out and these issues that arise, and are probably happening in all sorts of other areas at the same time. I wanted to ask a fairly sort of broad question to kick off, if you don't mind. There are obviously lots of bodies involved with various aspects of the response to COVID-19. You have the NHS, you have central government, the Department of Health, you have Public Health England, and you have the local authority. How do the organisations interact at a sort of on the ground level? How clearly demarked are the various responsibilities of the different bodies, and how have you found operating during a crisis in what's clearly a very complicated field?
Thank you. I think the one thing that the pandemic has done actually is made the NHS and local authorities work better together, quicker. So it threw us together, which was a bit of a saving grace in a way. I think throughout all this, as Councillor Coleman talked about the ICS structures, the integrated care structures and the integrated programme structures, integrated partnerships, beg your pardon. Integrated partnership is the locality level, at the borough level, and the integrated care structure is at the 8 CCG level with the 8 local authorities. I think sometimes, I'll be honest, it's been like walking through treacle. We just have to get on with it and deal with the priorities as they hit us, basically, and we're being very resident focused. And then I think over the past 6 months, I think actually the government and the NHS has actually tried to make the demarcations very clear for us in terms of the vaccination is very much led by the NHS, but actually supported by local government. So we found the Novotel in October, November last year. We negotiated the price for them and then handed that over to the NHS to sort out the vaccinations. Where it's the pop-up at a locality level, I think the message is now going through to regional and national level. If it's anything to do with local people, leave it to local government, because we know our people better than the NHS at a national level. And I think that at the start of it was one of the issues, that there was a national discussions happening about how many vaccines should be delivered locally, where they should be delivered, how they will be delivered. And actually that didn't mirror what was actually on the ground. I think at a business level, things have been, I wouldn't say easier, because awarding the grants, and there have been several grants that have all needed the wrong criteria. And I can see Emily and Nicola are on the call and have gone through the pain more than I have. But it has been easier because the information and the grant has been awarded, and then it's for us to actually administer. So I think wherever possible, and this is not me being a control freak on behalf of the council, where we've been able to manage it and lead it, I think it's been hard. It's been really hard work, but we've got through it, and we've got through it really well. I think where we've had to come together to work with our NHS partners, I think that has come together really well. And as such, from that now, we've learned from that, and that's how we've built our ICP structure, so that not only is it jointly chaired by an NHS colleague, but also Lisa Redfern is the joint chair to make sure we're on an equal footing. Does that answer your question, Councillor?
Yes, excellent. Thank you very much. It's interesting you used the example of vaccinations. I think that's that was an issue that's I wasn't entirely sure about. I went to get my second jab last week at the Novotel. It all worked very smoothly. Everyone knew what they were doing, and we're very efficient in showing everyone around. So it all seems to be working on the ground.
Yeah.
Perhaps Emily, this may be a question for you. So the last time we discussed this a year ago, we talked about the loss of income, but then also the total expenditure, so sort of the cost of COVID for the council, and just financially. Obviously, we know there's been all sorts of awful human costs and costs to people's well-being. But in terms of the pounds and pence amount that it's cost the council, I think we had a figure of 38.5 million roughly last time in terms of total expenditure and loss of income. We've obviously had lockdowns and additional waves since then. Do we have a figure, a headline figure for what the total cost has been to the council?
Hello, Emily Hill, Director of Finance. I would say roughly, Councillor Ree, it is as we had reported. The sort of headline broad figures in my head is a sort of a 20 million additional expenditure and a 20 million lost income. So roughly, if you were talking about 30, we towards the end of our forecasting last year, we were getting it about right. There'd be a lot of sort of changes during the year. But yes, there wasn't any significant change. Whilst there were additional lockdowns, as you say, they were of a kind of different nature, really. And so we'd already forecast sort of losses of income through to the rest of the year, and we didn't sort of see those exact same patterns in the next lockdown. So that ballpark was about right.
Okay, so we're not seeing any additional losses of income now. I mean,
so we continue to have losses of income in Q1. So sorry, that was just the last financial year. There continues to be the government's fees and charges compensation scheme for the first quarter, and there's no current confirmation that will extend. So we will need to sort of look at that as we've just finished the first quarter, really. But certainly things are having opened up, things are starting to creep back in, but there will be a number of things that have a time lag on them. You know, certain things as well, people are still nervous about booking in advance, given the sort of unpredictability of things. But we're starting to see things creep back through. First quarter, at least, we will have some level of compensation from the government on that. What we're seeing at the moment in terms of expenditure is increased levels of demand. So we were worried about some of the demand coming through. We are starting to see that. We particularly, I think our biggest cost is the additional costs as people are discharged from hospital, because people are moving through hospital more quickly now, and other people coming through. We're seeing more hospital discharges that are coming through from the NHS at a higher cost than those that we would normally have had. So that we're keeping an eye on and we're monitoring at the moment. It's very difficult at the moment to sort of forecast for the full year, so we're monitoring it at the moment. Certainly at sort of month 2, we thought there was possibly an additional 1 million of costs. When we looked at July, we think there's another 1 million. So there's definitely some social care costs coming through higher than they did before, as we're seeing discharges sort of move through the system.
And how long, in terms of budgets, are we forecasting the pandemic to last for? I suppose, you know, as long as it's going on, there will be less income than we were expecting. How long?
Yes, I think we are sort of forecasting a sort of return to normality over the next sort of 6 months, but still sort of with a bit of a delay and a lag in some of the areas, sort of planning fees being one of them, which is a larger one of our income sources.
Okay, excellent. Thank you very much. I'm sure you're all getting fed up with the sound of my voice, so I'm going to ask if any other members of the committee wanted to come in and ask any questions at the moment. See a hand from Councillor Cooper, then Councillor Stanton, and then Councillor Vincent. So, Councillor Cooper, over to you.
Thank you, Chair. I just wanted to ask, so Hammersmith and Fulham, we've got the third highest case rate in London at the moment. I just wanted a view on what we think the main driver of that is. Is it low vaccine uptake, or is it something else that is particularly driving, given that, sort of, for example, places like Brent, which has equally got, or I think even a higher number of ethnic minority residents than H&F, is currently lower down that list. I'm just wondering why it is at this particular moment it's so high here.
So thank you for the question. It's a really good question. I think our population age range is a lot younger than other local authorities as well. Look, so what we're finding now is our higher rates are in the younger age people who are unvaccinated. That being said, we are getting case rates for people who are doubly vaccinated, but they're not getting as sick. So we're seeing probably sort of the numbers of people who are coming into the borough as bringing some of that case rates into the borough as well. You're right, it's not always the highest rates at this point now in our Black and ethnic minority communities, but it is linked with deprivation still and age rates. So we know there is a causal link between age and unvaccinated people as well. And that's why we've got to keep that message to keep going. So we're doing some work with younger people as well to try and understand what are the barriers to being vaccinated, what are the concerns, etc. And we know some people, because some people have been untouched by COVID up to now, and now we're finding a lot more younger people. I think there's a bit of a shock in the system of younger people now thinking, blimey, I know there was something on the BBC the other night with a young man in an intensive care bed that was quite shocking. So, you know, I think we've got to keep the conversation going with people.
Yeah, actually, I was literally going to touch on that, the fact that it now seems to be younger people who are most hesitant to get the vaccine for kind of obvious reasons, given that they are objectively least at risk. So what measures are you taking to reach out to? I mean, I know that there are lots of young people who are quite, you know, it's a transient population. They can be quite hard to get hold of and don't particularly engage with the council particularly well. So what are you doing specifically to try and contact them, to try and reassure them, or not even to reassure them, just to tell them that actually they really need to do it?
I think you're spot on. I think they don't want to particularly talk to the council. They don't want to talk to middle-aged fuddy-duddies like me. You know, they want to talk to people. So we're doing some work with the Health Watch. We're doing some work with the H&F Youth Council as well. And also starting a conversation with the businesses in the borough, you know, any restaurants, sort of pubs and clubs, about who are the type of people, how can we get those messages across to young people. I was at the vaccine centre recently, the Chelsea vaccine, where we unfortunately didn't get as many people through as we'd wanted to. And talking to a number of young people, the key factor was going on holiday. We had a lot of students fresh from uni who wanted the vaccine to go on holiday. But unfortunately, we've got this 8-week gap now. So I think some people have had it and then just decided, oh, well, I'm going on holiday anyway. And, you know, that increases the risk. So we're looking at not only who's the best people to have conversations, but what are some of the things that might entice people to come and have a conversation about a vaccine. So some incentives about whether it be, you know, vouchers for nights out or whatever. You know, we're working with Westfield for gift vouchers and things like that. Just something to get things forward. But if anybody's got any thoughts or ideas, please do let me know.
Thank you for that.
Thank you, Councillor Stanton.
Sorry, you're on mute.
You're on mute.
Yeah. I'm only on Zoom for about 10 hours a day, 5 days a week. You'd think I'd have known. Firstly, yes, thank you, Chair. My first question is actually a follow-up to Councillor Cooper's, which is this, and then I'll ask my question if I may, which is that although we're the third highest rate in London for cases, is there any figures on how many of those cases are symptomatic, or how many are actually leading to hospitalisation? In other words, you're saying that we've actually got quite a high level of young people being infected. So could it be hypothetically that although we're the third highest in London, we're the 10th or 15th highest in actual, if I can put it in sort of these terms, in serious cases, or does that actually follow with those numbers?
So no, they don't actually follow each other. So we have got a pressure on our NHS, but we've not got the same pressure as we had this time in July. So what we are seeing is the impact of the vaccine, which is great, that whilst people are testing positive, and not everybody is symptomatic at all, in fact 1 in 3 have no symptoms, and we're seeing a slight variance of symptoms also for the Delta variant. Not everybody is hospitalised. However, for those at the highest rate, which are our younger people 19 to 35, those being admitted to hospital have increased. So we've not got the same pressure on the NHS. In fact, we do have the pressure, but it's out of hospital as opposed to in hospital pressure, if you like. More people are seeing the GPs than they were in wave 2 and wave 1 as opposed to now. But there is a growing pressure still on the NHS.
Okay.
Can I just add something quickly to that, Stanton? Just it won't come as any surprise to you, but I'd just like to make the point that talking last week to the Chief Executive of Imperial and hearing from people who were talking to Chief Executive of Chel West, at the moment, or certainly at the time we were talking to them, no one in hospital with COVID had been vaccinated. In other words, all the people, it may change as the day-to-day moves along, but at one point last week and a point, I think, yesterday, everybody in hospital who had COVID had not had a vaccination, and this is people of different ages. And it's a point that comes as no surprise, but I think people need to understand this. You have a vaccine, it will protect you such that you may still get COVID, but you will not end up in hospital. If you don't get vaccinated, there's a much bigger chance that you'll end up in hospital, whatever your age. Not quite to answer your question, but I thought it was an interesting point to hear that, our experience of our 2 hospitals.
Absolutely, thank you, Councillor. I mean, I suppose the natural progression from my comment, and I guess this is a broader thing for the nation, really is at what point do we start considering that this is like the common cold, and that actual absolute numbers aren't as relevant now as they were once before. But I guess that's probably not within the remit of this committee to discuss. So if I may go to what was going to be my question, which is more about future planning for the council, and also the long-term effects of what has already happened, by which I mean, do we have any idea of what sort of business closures we've had within the borough over the last year due to closures, in particular with the hospitality industry, albeit they are now reopening? And secondly, what planning has the council done in case the pandemic continues for the next, I don't know, 8 months or 6 years, so 6 months or 8 months, 12 months?
Thank you. In terms of the numbers of business closures, I'm not sure, well, I can't answer that. I'm not sure there's any colleague on the call at the moment who can, but I can certainly come back with a figure, if I may, on that. Certainly, yes, we have seen them without a doubt. In terms of what planning we're doing to maintain this and continue, one of the things that we're working very hard is about sustainability of the work we're doing. Right from day one, we said we're not going to start something we can't continue, because we knew this was in a long run. So every department has scrutinised every part of the work that they do, about what is essential, what is necessary, what things need to change to enable the recovery of the borough, not just the council, the borough and its partners. And we continue through our new governance structure, which will be looking at the new ways of working, how we can build back better to our civic campus, how we can change the way we work, but also work with our partners. So that's the part of the recovery work that we're doing at the moment. So that's not just something that purely sits with me, it sits with every department in the council. And we've taken that work very seriously. We've built a COVID board, which we continue to maintain. So we keep one eye on the numbers, we keep one eye on the infections and how we can continue to provide a response service, because we're still providing that emergency response service to people, whilst we can then start to build back our other services to what will be the new offer from the council. And that has to look differently because people's priorities have changed now in COVID, business priorities have changed and people's expectations have changed. So we need to do that, but we need to do that together with the communities, and that's come very, very clear from the communities.
Thank you. I possibly have some more questions, Chair, but I'll let Councillor Vincent.
Okay, thank you very much. Councillor Vincent, over to you.
Thank you, Chair. Slightly curiously, am I allowed to answer the previous question, since I can help a bit on the businesses? I mean, wearing my hat as local business champion, I can tell you that talking through the local businesses, we're probably not suffering currently as many businesses going down as you might expect, because of the nature of Hammersmith and Fulham has a particular sort of profile of businesses which is fairly solid. However, the general view of all the people who I talk to about businesses is that there is going to be a problem, because a lot of businesses, smaller businesses, are overwhelmed with a lot of debt. There are a lot of reliefs that the government gave out which are now coming home. You've got to pay your VAT, you've got to pay your corporation tax, all these things which people have been able to avoid. So it is probably going to be, the profile will probably be that we're going to see more businesses going down over the next few months as rents, obviously landlords are going to be not so forgiving about rents once they're open again. And indeed, I suspect a few will stagger through to Christmas and then die after that. That sounds a bit glum, I'm afraid, but I think that's the reality of the way in which the market is probably going to work around here. Well, that's any help. And I don't think we have the actual figures because we simply don't have that sort of mechanism to gather it. Anyway, I was here to ask a question. Firstly, can I just congratulate Linda and Ben on their leadership of the team? I mean, I think this has been an extraordinary time. I think the council's risen to the occasion. I think, done extraordinary work all over the place, particularly bearing in mind that some of the time it's been sort of working with one hand tied behind its back due to various central government policies. So I think, everybody should be congratulated, the whole team. Can I raise, though, one question about, you've mentioned, Linda, in your report a lot about all the work you're doing with staff for the council, which is great. However, there is, we forget sometimes we're not talking so much about the millions of people in the country who actually, from a work point of view, haven't even noticed COVID because they've just been working straight through. And there will be a number of people on either directly or indirectly on the council payroll, for instance, the refuse service, who have simply just not stopped working. So the idea, it's all right for people like me who are, cowering, if that's the right expression, in their back bedrooms, getting on with the work. But if you're on the front line, the guys who come and take my bins away, other people who do a lot of work, social workers, I imagine, all sorts of people who've been out there regardless. Can you give us a flavour of how we've been looking after those as an employer, or as an indirect employer in terms of the refuse guys? What sort of risks they've been under? What sort of support we're giving them? Because you've got a very large piece of paper about the remote working and so on, but give us a flavour about the people who have just been carrying on regardless.
Yeah, thank you. A really important point. At any one point, we've had between 300 to 400 people working on the front line in the borough, as you say, 365 days a week, a lot of the time. We have kept in very close contact with those people through their line management. We've done lots of sessions, and Dawn's on the call. I'm sure Dawn will want to talk about the Wellbeing Wednesdays and the support to employees that we've given. We've made sure that our staff who were on the front line had access to testing as quickly as we could get hold of it. So we offered them routine testing to maintain their safety and that of their families. Especially in the refuse, we set up a testing centre actually there where they could get straight into work, straight into a test before they went on the road. We were mindful to make sure that everybody had PPE right at the start so that everybody had correct access to the correct PPE and was given advice and training as well. And also when the vaccines became available, we made sure that our frontline priority one staff, that's those staff who were at the front line, face to face with the residents, with the public, also access the vaccine as quickly as were possible, and were encouraged to access the vaccine as well. So I think, you know, they are the people that don't get flagged, you're right, as much as possible. But I think, you know, throughout all this, we have been talking to them, we've been working with them about how could we improve their life working within the borough, keeping them safe, and we've listened to that. And because of that, we've taken away some of the learning from that as well about actually which are our priority services, how we may prioritise our services in the future. And that actually, at one point, there was a bit of a clash between ourselves and the NHS, as you would imagine. What they were saying were frontline social care staff were priority, and we were saying, yes, they are, as our parking wardens, as our refuse collectors, you know. So we did have a couple of interesting conversations, but I think the take-up has been generally overall really quite good in those areas. But we continue to encourage people to talk to us and to take up vaccinations and ongoing testing, because that is the key now, not just the vaccinations, that they have ongoing tests to ensure that they remain safe. And if they do get COVID, we're able to get them home quickly and as safely as possible, and also that they are supported to social isolate, because that was something else, not only for our staff, and not so much for our staff actually, because we pay sick pay, but for a lot of the social care staff out there, but both children's and adult staff, if people weren't being paid to be off sick, that was a deterrent for them to self-isolate. So we actually supported them and underwrote that we would pay for their ability to stay at home to be off sick for the 10 days as well. And that was something that was really taken on board and enhanced people's lives.
I mean, near the beginning, during the early stage of the pandemic, there was horrible publicity about a higher mortality rate, sadly, amongst bus drivers. Do you think we had any sort of problems with that? And can I just ask specifically, you said that you were supporting people in order to go home, which is great with sick pay. Has that occurred through our subcontractors? So, I mean, again, particularly the refuse people who, of course, are not directly employed, have the employers of the refuse and other services been as generous as we would be?
Yeah, so we work very closely with the refuse collectors. In fact, we did have an outbreak when myself and Dr. Lang were leading the conversation, and we actually said, you know, if you are not paying your staff, we need to know, because we will pay them. You must support them to stay at home. They were very supportive. We've had ongoing conversations with TfL, and that has been quite difficult at times. But we offered TfL testing for all their staff as soon as we had it available for them. They were slow to come to the table, but have eventually come to the table. So at the moment, we've no issues with TfL that I'm aware of, but certainly refuse staff have been supported, and our parking wardens as well have been supported and taken sick leave. So there's not been an issue with our council staff or our council contracted staff that I am aware of, where people have not been able to self-isolate.
That's very helpful. Thanks, Linda.
I could just add to that. You know, what Councillor Liston, but of course, you know, you're raising a big issue here, which is the fact that the statutory sick pay at £9 a week is pathetic, and that it simply isn't enough for people to live on, which is why we said that any of our care home staff who had to self-isolate, we would guarantee up to £200 a week for, and just just offering that guarantee was enough to get most of them to get vaccinated. And one of the real, many mistakes which we've seen nationally throughout this crisis is the refusal to offer proper funding for people to self-isolate. Because we talk about, well, actually we don't. I have to say, the one party leader talks about test, trace and isolate, but it's not the leader of the government. He talks about test and trace. He doesn't talk about isolate, because you can only get people to isolate by incentivizing them to do that. And the only way you can incentivize them is giving them the money to live off. And one of the, I mean, how many billions, I can't remember the figure, but one of them, all the billions spent on test, trace and isolate don't include isolate. There is very poor support in this country for people to isolate. And yet that is one of the most important things that we, all of us, need to get out of this nightmare. And so the failure to fund that properly, I think, is one of the great, you wouldn't be asking your questions in the same way if that was happening across the country. And I think that's one of the great failures of this whole problem. There are other things that have been very challenging, which we've had to struggle with, and we're still nationally, it has been raised already that one of the big learnings from this has been the fact that locally we've worked better with the NHS than we possibly ever have in my time of doing this job for a few years, and other people doing it. But we've learned that that's needed, that you need to listen to what happens locally. And we are still nonetheless grappling with, quite honestly, idiotic rules set nationally. For example, we now learned that one of the most effective ways to get people vaccinated is bring it to them. As the report says to you, we've done things like have community meetings led by community leaders that had some impact, but taking buses onto estates, going putting pop-ups, short-term hubs. I went to in the north of the borough today. I went to a mosque that was doing open for everybody to get vaccines in, and pharmacies are tremendous ways of getting people vaccinated. I went to one again in Although today, getting 150 people a day vaccinated, many of them young people. On Sundays, they're opposite a church, a lot of black people coming and getting vaccinated, which we've already addressed as a problem. So we say to the government, we've got 4 pharmacies that you've approved, 4, and it really works. We'd like to have more pharmacies approved, of those who are big enough with the space, as vaccine centres. And they've decided, NHS England, in their wisdom, not to approve any more pharmacies across the country as vaccination centres. Why? Some people suggest it's because there isn't enough vaccine out there. Other people say, oh, because they've got to get ready for the flu vaccine, which seems to me a weak reason. They can do COVID now and flu later. But there is a real problem nationally with them listening to what is being said we need locally. Another issue nationally that's a problem is the symptoms. If you are symptomatic, you need to get a PCR test, and then you will know 100%. They're better than the lateral flow test. You will know 100% if you've got COVID or not, and if you do, you need to self-isolate. Although, if we said that can be challenging financially. Well, if you've got the Delta symptoms, which are not the same as the standard COVID symptoms, if you've got diarrhea, aching muscles, blocked or runny nose, if you've got long-lasting headaches or vomit, sore throat, and you generally consistently feel tired and unwell, these are all now recognised as symptoms of having the Delta variant of the virus. And yet still, our public health director is having to write to Public Health England and say, will you formally recognise these symptoms? Because otherwise people aren't going to get PCR tests. Now, in Manchester, where they're able to run their own health and care system, they're already putting out this to the population and encouraging them to get tested. But we have, again, a national system which is slow and unwieldy and not listening to what we need to do on the ground. There are other problems. I'm going to say something about TfL, if I may. I've been deeply unimpressed with TfL throughout the whole of this crisis. Deeply unimpressed. I do not consider that they have spent nearly enough time or resource on protecting their drivers. And I don't think they spend enough time and resource in encouraging people to wear masks on the tube. And now they say they've obviously brought in their own rules to say that you have to wear a mask on a bus. Well, I don't know anybody wearing a mask on buses, and I keep being told by people who have the strength of character to travel on buses that there are very few people doing those. So I've asked our environmental health people to do a bit of a random sample of buses in the borough, looking at buses, particular route, the busiest routes, and just see how many of the people getting off are wearing masks. And I'll share that with TfL. But throughout the crisis, I've not been impressed by the way they've protected people. And of course, the really bad thing here is it's the poorest people who have to take the buses and have to take the tube and can't jump into taxis and get the Ubers, and who have to go to work every day cleaning the buildings and doing all the other lower paid jobs. And many of them are from Black and Asian and other ethnic minority groups. And this is something I still find very, very shocking. Final point, if I may. Why young people should get vaccinated? The one thing we're trying to avoid is a further lockdown. This is what's getting, and if the rate keeps going up, we'll find ourselves in a further lockdown. The businesses that we've been talking about and everybody else will be so badly affected. And although it's a small proportion of everyone who gets infected, who are who fall ill if they're young people falling ill and ending up in hospital who aren't vaccinated is a small proportion of everybody. The more young people who get who aren't vaccinated and get ill, it's going to suddenly become a small proportion, but a very large actual figure. And that's going to be challenging for the NHS to deal with, let alone young people themselves. And of course, the more of them that get the virus, the more they're going to pass it on to other people. And even if you've had the vaccine, or 2 shots of the vaccine, as I think most people here, perhaps all of you, have 2 shots of the vaccine, it's not 100%. The virus can still, I mean, if we're putting this in deeply layman's terms, the virus can still bash away at you. And the more exposure you have, again and again consistently to the virus, the more chance there is you will become ill. And so if you have lots of young people running around who haven't got the vaccine, they are more likely to infect other people who will, even if they're vaccinated, who will end up in hospital, and more like themselves, in simple number terms, to end up in hospital. And then we suddenly find ourselves moving towards the dangers of a second lockdown. I just thought it might be worth mentioning that. Not that there's probably anybody under the age of, well, I won't say what, watching this tonight.
Thank you very much, Councillor Coleman. Councillor Vincent, did you have any other questions you wanted to? Excellent. If I might just jump in here to talk about something slightly different, and that's the community aid network. So I remember we had a really great swell of enthusiasm, I think, from people all across the borough who wanted to get involved at the height of the pandemic and to help to deliver food to their neighbours, to look out for people who are living on their own, and all of this sort of thing. I'm sure we were all members of the mutual aid WhatsApp groups that that were running with hundreds of people from across the borough. Now, I was looking back at the previous meeting a year ago and spoke about this, and I understand we had a number of staff seconded from Imperial College to come and look at whether or not there was anything we could do to try and sort of harness this going forward and keep people engaged in what was going on in their community. Obviously, keeping people safe is the main priority and what we should be focusing on. But I was just thinking perhaps in the slightly longer term, if there'd been any thinking that had come out of this work in terms of things we could be doing in the future to try and make sure that this enthusiasm is harnessed and can be put to good use.
Yeah, thank you. So the community aid network is still ongoing. Really pleased to say we've still over 200 members of the community aid network, and we've started to formalise the offer. When we first started, you know, we didn't really know what to expect. It was a bit of a scramble. We've learned from that, and we've now formalised it. So there's a formal inductions, people have training, and they're all skills and knowledge that can go onto a CV, which allow people to get employment and training opportunities. In fact, I'm really proud to say that 2 of our community aid network volunteers are now employed by the council in our contact centre. And it was only as a result of opening up their eyes to what could happen in the community actually gave them a thought about doing something different. So the community aid network continues. I think what our Imperial colleague actually said was, how do we build on the legacy? We mustn't let it go. We've got to build on its legacy, which is where we are now taking the next step on a programme sitting alongside the resident access programme, the REAP programme, which Nicola leads on. The phase 2 of that was the one front door. So we are looking at how we can build on the use of the volunteers with the Conversation Matters team that we also set up, which was a mixture of volunteers and social care workers, occupational therapists, to be able to provide an immediate response to people's needs, and building on the CAN contact centre to become the one front door initially for adult services, but then also we'll move on to housing services and children's services. It's probably over a 2-year programme. So we're really keen to keep that going and maintain that, and that is working really, really well. I'm proud to say, and we can give people stats on anything that's needed there.
Fantastic, thank you very much. We have looked at the REAP programme in the past in this committee, but I think that's something that was worth our while looking at again in 6 months or so,
Yeah,
just to sort of pick up on the good ways.
And one little thing about CAN is they're phoning up and they're doing welfare checks on people. So we're supporting that self-isolation, which not everyone's doing this. A lot of the stuff we're doing, no one else is doing. Or they hear we're doing, they do it afterwards. But from very early days, we've called up people to say we don't have to self-isolate, to talk to them. Are they going to be able to shop? Are they going to get the support they need in other areas financially? And even that we've had small grants we can make available and sources of finance. So we're doing this, and then we call them up again, see how they're doing, which enables us to both encourage self-isolation, but also we're trying to wrap our arms around our residents as much as we can. And we're doing these welfare checks, I think, makes a big difference. We also write to people, everybody who's been shielded. We've written 2 or 3 letters I wrote again last week, saying that CAN is still there for them and all the other things that's still there. So we're trying to do as much as we can to support people to self-isolate, even though the simplest way is to make the government to make the financial backing they need available.
And may I just add one more point, Councillor? Apologies, but just to say, as a result of the work, not just me, when I say my team, I don't actually have a team, but it's people that are in this room, it's the many, many staff that have worked alongside us. I think we've now just been told today, I think hot off the press, that we've been shortlisted for 8 LGC awards, including public health, including how we've used digital technology in the pandemic. So, you know, we really are learning from what we've done, and we're not just doing it and saying we're good at it, we're proving it as well.
Well, that's fantastic, brilliant, well done. Does any other members of the committee have any further questions? Councillor Cooper.
Only just very quickly, just kind of following on, you know, from Linda and Councillor Coleman's points about local authorities often doing things better than central government, and you know, our contact tracing effort in HNF, I assume, is one of the things that we are being recognised for. How is that coping with the number of cases at the moment? Is it coping? Do you need further support from central government? You know, is that partly is the fact that system is coming under pressure partly behind some of the rises in cases that we've seen, do you think?
Yeah, really good point. Again, I think we've been at the forefront of the testing figures for nearly 9 months now. We led the way, certainly across London, with the highest number of tests being carried out. So obviously more tests, more people will come forward. We have the foresight to do some planning in advance, and we're able to forecast the figures that we expected to grow over the summer and then over the winter, with a drop and a lull. So in preparation for that, we did a plan which increased the numbers of staff actually in that contact centre. Yeah. So not only do they do contact tracing, they ring people for vaccines as well. They also manage the CAN volunteers. So the multifunctional team, they're not just sort of one team. So we've been able, I mean, Emily will not forgive me if I don't take the opportunity to say, of course, if the government want to give us any more money, we'll find a good home and a good use for it. But at the moment, I think, you know, with the foresight and the planning work that we did, we're in a good position at this moment.
That's really good to know. Thank you for that.
Because the more people that you test, the more that shows up in the infection figures. And there was a point at which I would have said with absolute confidence that we were testing so many more people than other councils that was definitely skewing our infection figures. That may or may not be the case now, so I wouldn't say that, but that has been. We do have, we've got one GP, private GP in the borough who's done about 63 tests, which just still keeps feeding through to our figures, and we keep saying to the government, can you take that out of the figures? And they keep somehow saying, oh yes, it's terribly complicated, as you'd imagine, and that's skewing our figures as well. And obviously other councils have been in third place. We've gone in and out of that. We were talking about the reasons, and that the testing that we're doing may be one of those reasons, but I can't say that 100%, so I'm just positing it. But I know that Linda has done extraordinary stuff. When the government was only hitting 60% on when test and trace, national test and trace, it should not be called NHS test and trace. It is not NHS test and trace. It's a national system, private system, and they were hitting 60%, I think, and then they were doing 40% of people couldn't be reached. They were the unreachables. They passed them to the councils, and we reached 99 and then 100% of all those people. Just by doing many things. One of the simplest is just walking over to where they live and knocking on the door. And we were one of the very early councils to get recognised for what we were doing there. It was a pilot, and now it's a standard across the country. But there are a lot of things, lessons which need to be learned from this crisis. You will have your own view about what will ever be an effective investigation into it. I think the government has got it largely right on vaccination. I have to say on everything else, I think the jury is still out, very, very far out.
Thank you very much. Well, if that's all for questions, then I want to thank you, Linda, and thank you, Councillor Coleman. I think it was really useful having that update a year on. We've covered a number of issues that we didn't cover a year ago. And so we're really starting to see just how complicated a problem or complicated an issue this is, and the various issues that come from that, whether that's in terms of the inequalities about how people are getting vaccinated, or whether that's about various shortfalls in central government support. I think it's been very helpful having a second meeting to go back, and perhaps we can pick this up again. Hopefully in 12 months' time, we'll all have forgotten what COVID is, and we won't be talking about it anymore, and we'll all be back to normal. But perhaps it'd be useful to hear about this again at some point in the future. And the other thing I wanted to say, Linda, Ben, thank you very much to you and everyone who's working in your teams, and everyone across the whole council. It seems like we've done an absolutely fantastic job in terms of keeping people safe, making sure people know what they should and shouldn't be doing, and yes, very much making sure that the system's working properly. So I'm sure on behalf of the whole committee, I can say a big thank you, and hopefully you'll be able to pass that on to other people working in your team.
We have a fantastic officer team, right through it, and they've been doing an incredible job at keeping people safe and protected. So thank you for recognising that.
And fingers crossed for these awards as well. Let's hope we can bring home some silverware. Well, thank you very much, and I think that was a really good, really interesting item. So we are now going to move on to item number 6, which is an overview of the complaints process. The complaints and customer service framework falls within the scope of this committee. So I think it would be useful for us to understand perhaps a bit better about how it all works. I will just say, remember, we are being broadcast publicly. So let's perhaps try and keep the discussion to the framework as a whole, rather than making any sort of saying anything that might identify individual people who may be having issues at the moment. So I'm going to hand over to Nicola Ellis for this item. Over to you, Nicola.
Good evening, everyone. Nicola Ellis, Assistant Director, Resident Services. So I was asked to provide the report looking at our corporate complaints process, including how complaints are made, the process for dealing with them, and also how we monitor and follow up on them. So I'll take it that you've read the report, just to pull out a few key points, really. So our complaints process is it's been reviewed fairly recently, last May. It is based on the guidance from the local government ombudsman and the housing and social care ombudsman. So you'll see that it is very much in line with most complaints processes across the local government. It's important really to understand what we deem as a complaint, because often a resident will contact us as a result of a service failure. And at that stage, it is a service failure, and we try and obviously resolve everything at that first point of contact. But often, well, hopefully not too often, but sometimes it does go into our complaints process. And we deal with that complaints process. It's managed by a central team within the resident contacts service, and that's the resident experience team. And we coordinate all the complaints across the council under the corporate complaints process, although they are actually responded to by the services. So in order to make a complaint, there's a variety of channels that people can make complaints through. So online, by email, by telephone, by writing, and as you'll know, via your local councillor or via MPs. We have a two-stage process. So the first stage is a stage 1 complaint that's dealt with within the service area. We have a timescale for dealing with them within 15 days. And obviously we try to resolve as many of them at that point. If there are still some outstanding issues after that complaint process, then it goes to stage 2. The vast majority of stage 2 complaints are then dealt with by the resident experience team. So it's a sort of neutral view of what the situation is, and they'll follow up the information with all the service areas. And then there's a 4-week timescale that we aim to achieve in terms of stage 2 complaints. So after the stage 1 and stage 2 complaint process, then the resident, if they are still dissatisfied, obviously we hope they're not, then they go through to the ombudsman, the relevant ombudsman, whether it be the local government and social care ombudsman or the housing ombudsman. So in terms of following up on complaints, as I said, managed sort of centrally through our resident experience team using our iCasework case management system. All officers have access to that system that deal with complaints, and so we have a central record of the complaint for the individual and for all of the complaints that they've had. So there are automatic reminders sent to officers when a complaint's reaching its due date, and we very, very closely monitor performance against timescales. Now, this is an area that's a key area of focus for the council and for our strategic leadership team in particular. There have been, some significant developments over the past sort of couple of years in terms of changing our processes and looking at better ways to manage a timely response to our residents. So one of them being, we've just introduced a new iCasework system, which is a much upgraded system to the one that we've worked with for many years before. That went live in early June, and that gives us an opportunity to better develop some of the reporting that we've got around our complaints, so that we can learn from them in terms of the root cause and the opportunities to sort of improve our services further. Each quarter we report to our SLT assurance meeting, and that includes the quarterly performance broken down for each area, so in terms of each department, and some analysis on trends and actions to address. So I'm happy to take any questions that you've got with regard to the complaints procedure.
Excellent. Thank you very much. Thank you very much for that, Ms. Ellis. I just wanted to ask a quick question, if I could, about the reporting. I think people on this committee will be sick to the back teeth of me banging on about my slogan, you can't manage what you don't measure. So I'm quite interested to hear about how we go about recording complaints and the progression of complaints. Do we break it down? Is it by department, by service? How granular is this reporting?
So when we formally report, we report by department. So really in terms of economy, environment, and broken down at department level. On a weekly basis, we provide reports to service managers on their own complaints on those that are overdue or reaching the due date, so that they can manage workload through that means. So, but mainly in terms of managing performance, it's on a department basis, although we do drill down into that in a lot more detail within departments. So, I mean, if I take environment as an example, because that's the department that I'm in, we look at them specifically for each individual service area as well. So there is the facility to sort of drill down deeper within departments.
Excellent, thank you very much. And one final point for me, in terms of trying to foster a culture in which everyone is trying to put the residents first and looking to provide the best service possible to people living in the borough. Do complaints factor into the appraisal process for individual members of staff?
I think in terms of whether specifically the complaints do in terms of what's my way of putting it? Not in terms of you have had these many complaints about you as an individual, but more in terms of looking at the opportunities for improvement, really. So just to give some reassurance around resident focus and how important it is for the council at the moment, we really are doing a lot of work on culture change. And we talked, Linda talked a bit about the REAP programme and how that is looking at the way we deliver things differently, but also looking at a big behavioural and cultural change. Complaints is a key area where we really want to encourage our officers to really take ownership of their complaints and to look at, focusing on the resolution at the first point of contact. We've just introduced fairly recently some what we call clicks, continuous learning and improvement cycles, where groups of officers get together and we'll look at reviewing particular issues with particular cases and even ombudsman cases, so that we can make very quick suggestions working across the whole council, members of different service areas, as to how we can use that feedback from residents to make changes to improve in the future. But just some reassurance that the resident focus and ownership is really key for us going forward.
Excellent, thank you very much. Councillor Vincent.
Thank you, Chair. I don't mean to sound ungracious, but why have we got this report? It's a very nice précis of the what's on the website, and any active councillor will know what the complaints procedure is, because we will have enough people asking us how to complain, and I'm sure all my colleagues have read the complaints procedure. We also have complaints about the complaints procedure, so it tells us what we already know, and it tells us what's on the website, so I'm not quite sure why it's here. It would be useful if it told us something about what actually happens to the complaints. In other words, do we have one complaint a year, or do we have 1,000? How many complaints go to stage 1? How many complaints go to stage 2? Where are the areas in the borough where we're getting a lot of complaints? Because if we've got one department which has got a lot of complaints and one department with no complaints, that might be useful. So at the moment, you're not telling me anything I don't know, and you're actually missing out all the stuff that I'd be interested in. So
I can absolutely report all of that information to you.
Yeah, that'd be great. Can you tell us what's going on with the reporting? Because that's the interesting bit. I mean, I know how the system works, for goodness sake. I mean, I've seen enough of it, and I've seen enough people complaining to me about how it doesn't work properly. But that's another story. So how many complaints do you get a year over the last few years?
I haven't got those figures completely to hand, but I can absolutely provide that report to you. Over the I mean, the quarterly report is being compiled at the moment, so I'm happy to provide a copy of that quarterly report. But anything that you want in terms of performance figures, I'm happy to report those to this committee also.
Well, do you want me to send you a list of questions rather than, I mean, it
yeah,
might be
absolutely.
Useful,
please do.
We can actually get some useful information about this, because it's nice to know what the complaints procedure is, but we know all that.
Yeah.
Forgive me if I'm being ungracious, but anything you can tell us. And does it work? Is it popular? How many do you get? How many complaints do you get about things? I mean,
I can absolutely tell you.
Complaints?
I can absolutely give you loads of information on complaints, and I'm happy to report anything you like. Yeah, I was just specifically reporting on what I was asked to report to in that.
No, I'm sure you were. No, sorry, forgive me. I'm not.
I'd be really grateful for you to send me any questions that you've got and any feedback that you've got directly. That would be absolutely fantastic, and I'm happy to report on anything and bring it back to this committee.
I'll send you a list of questions.
Yeah, do. Thanks.
Thank you.
Okay, perhaps if we could circulate the questions and responses across the whole committee. Councillor Cooper.
Thank you, Chair. My question is around transparency. Just because I've had some issues with the fact that, you know, a resident will make a complaint, they get a response from the council, you can move it on to a stage 2, you get another response from the council. And yet it's the council marking its own homework at that particular stage. And unless you choose to move it on to the ombudsman, to an external, which is, you know, at this point, quite a lot of hassle, a lot of time. What I think we've sometimes found is that, you know, that the response will come back, well, okay, there's nothing here to see. And maybe there isn't anything here to see, but there is nothing that there is a lack of evidence or a lack of information that the council can then provide to residents. And I understand that in some cases there are, you know, there's GDPR, there's, you know, there's information about particular council officers that is personal, that cannot be made public. But I suppose what I would be really interested in is understanding exactly what those rules are. What is it that a resident, where does the point come at which, for example, a particular council officer is involved in a complaint, at which you know, then it's a matter of the employee's privacy versus a resident's right to understand why their complaint might have been dismissed or not dealt with in the way that they want to. I'd really appreciate some kind of clarity over that particular issue.
Are you talking about a complaint specifically about a particular member of staff, or I'm
making a general point here. I have come across cases where a complaint has been made, not necessarily specifically about a particular a person, but then has obviously has involved, you know, there is an individual or individuals involved in that, and then a complaint, you know, the complaint has come back saying there is nothing to complain about, but there is sort of no attached information to that, to the resident to understand why there is nothing. And the reason that has been given has been because it involves the privacy of particular officers. I totally understand that you know, like obviously employees have rights to privacy. I just want to kind of understand where that boundary is and what it is that resident that needs to be kept back, and why, really.
That's quite an unusual scenario, I think, because I can't say that I've only ever seen any complaints that have actually said anything along those lines. So if you've got any specific examples that you want to talk to me about offline, then that's absolutely fine. But I mean, normally in terms of it's a complaint about service, it's a complaint about a process. In terms of impartiality, as I mentioned, the stage 2 complaint, so the stage 1 complaint would usually be dealt with by the line manager of an individual if an individual is mentioned. The stage 2 complaint is then dealt with by the resident experience team, so completely neutral from that service area. The only situation I can think of that may be something that links to what you're talking about would be where something links into another policy, such as the disciplinary policy or the grievance policy, and so it's going down a different route. But I'd be interested to know if you've got some specific examples that we can perhaps talk about offline.
Yeah, sure. I'm just out of interest, if somebody does raise a complaint about X individual and this complaint is investigated, what will they, and let's say the complaint is dismissed, what are we entitled to share with that resident about what the line manager has come to the conclusion? You know, do they just get back Joe Bloggs is not guilty, or do they get back Joe Bloggs is not guilty because of this, that, and the other?
But yeah, I see what you're saying. Yeah, I think that is a difficult one, and probably my colleagues from HR will know a bit more about, you know, what we should be sharing in those terms. But I do understand what you mean now. Yeah, it's whether you end up with, or let's go to the worst case scenario, that it was an officer who had made a mistake and they'd been, you know, disciplined in some way, and whether you could share that information, because that would feel, as a resident, your complaint was validated and you'd got some comeback. And I think that is a very difficult situation in terms of respecting someone's privacy and the fact that they've gone through a process. In as much as I think it's very important to share what went wrong, more than, and what's been done to stop that happening in the future, rather than the outcome for that particular member of staff. But I see what you mean. I can understand, you know, putting my resident's hat on, how you want to know that person's, you know, being disciplined. But to be honest, they are few and far between where they're about specific officers, and in terms of, you know, the way an officer has behaved or the conduct of an officer is very, very rare.
Could I just make a request, just that we could be provided with just clarity, just so if this situation does occur, you know, we can say to residents, okay, the fact is that, you know, we will investigate this, but, you know, in the specific case of Joe Bloggs, this is what you are likely to receive in terms of information about what's happened to that, and this is, you know, literally we are forbidden by law, by GDPR, by employee confidentiality. We cannot tell you more than this. It'd be just really quite helpful just to have some specific guidance, just so we could manage residents' expectations if there is a particular individual that they are interested in. Yeah,
absolutely. I'll talk to colleagues in the HR department, and I'll get something over to you. That would be
brilliant. Thank you very much.
Thanks.
Okay, thank you. I think we've got another action there in terms of providing guidance to committee members on what can and can't be shared in response to complaints. Do you have any other questions on this topic? No, in which case, thank you very much, Ms. Ellis. I think that was a really good report, and I think we learned a lot from it. I think we were going, in terms of actions going forward, Councillor Vincent was going to suggest a list of questions that should be dealt with in private rather than a public forum, and then we could see the responses to those, and we're going to get some guidance on what can and can't legally be shared with residents in the aftermath of a complaint. So thank you very much. Thank you for your report.
Thank you
for coming and answering questions for us this evening. Now moving on to our 7th item, last but certainly by no means least, an issue that we talked an awful lot about before, but we haven't been talking about quite as much, so it's useful to bring it back up into forefront of our minds, and that's Brexit. I believe Emily Hill is going to be presenting on this report, so I'll hand over to you, Emily. Thank you very much.
Thank you, Chair. I'll share the screen and share the presentation. It will mean I won't be able to see you, Chair. So if people have their hands up and would like to answer any questions, perhaps you'll interrupt me and I'll stop. Otherwise, I'll take questions at the end. Okay. Please let me know when it's on your screen and you can see it.
Yes, I can see it.
Great, thank you. Okay, so the PSR PAC last took a report to this, as you say, some time ago now, actually in September 2019 when I looked it up. So at that point, we were heading into that sort of Halloween 31st of October deadline that we all remember, and wondering if we were going to come to a deal. In fact, on the way up to that deadline, the Prime Minister requested an extension to the 31st of January 2020 to come to a deal with the European Union. Sorry, I hadn't yet moved on to that slide. So with the deadline of the end of January 2020, the withdrawal agreement was actually approved by UK Parliament and the European Parliament in January. So from that sort of from the date of that agreement, there was a transition period that took us to the end of last calendar year, December 2020, and of course that transition ended on that date, and the 1st of January the UK left the EU single market. So really, when we spoke to you last, our biggest planning, and most of the planning that the council was doing, was around the risks in relation to a no-deal Brexit. That was the same in relation to London. The London Resilience Forum were looking at a no-deal Brexit, and clearly that was avoided. So a lot of the issues that we were sort of really most concerned about, were avoided through the extension and then the agreement of the withdrawal agreement during that time. So there was no real big bang that we were expecting as we moved from the 31st of December to the 1st of January, with most UK laws just transferring back to UK laws, and over time legislation will keep, amend or delete that legislation. So that's the background. I guess as this committee has just had its first item, actually, all of that's happening in a year, in 2020 and 2021, where we are in the middle of a significant international health pandemic. So I think, unfortunately for me, it's quite difficult right now to explain to you what the impact of Brexit, what we have felt in terms of the impact of Brexit. Very difficult to separate out the impact of Brexit and COVID at this time. And some of those key risk areas that we were concerned around Brexit, around social care staffing, the wider economic implications, and the impact on local businesses, those areas have been significantly affected by the pandemic, and probably the effects of the pandemic have dwarfed, at least in that short term, that immediate term, the impact of Brexit. So I think, actually, whilst I'll give you the headlines of where I think we are or where the uncertainties are, at the moment we're going to need some more time to assess the impact of Brexit, because at the moment it's clouded by the impact of COVID. Great. So these are the key issues. I won't dwell on this because I'll be taking you through each of those, but they'll be the things that this committee remembered we were saying were some of our concerns. A really successful area in relation to Brexit is in relation to the EU settlement scheme. The government does provide regular updates on statistics here in relation to the applications, so concluded applications and the outcome of those applications. You'll know that the deadline has now passed for anyone applying for the EU settlement scheme, and that was the end of last month. But we won't see the statistics coming through in relation to that last deadline now until for a couple of months. I thought I'd noted down when they would be coming through, but not yet. So we won't yet have those final figures because the deadline for the statistics since the deadline haven't come through. But as you can see, actually there's been 42,000, over 42,000 concluded applications, with many receiving settled status and pre-settled status, and only 1,000 of those with other outcomes. Now, really difficult. It's clear that the ONS has consistently underestimated the borough population born in the EU. So the latest statistics that we have from the EU was that the borough population born in the EU was 27,000. Clearly, we've had 42,000 concluded applications. So that certainly was an underestimate. So it looks as if we've certainly supported our residents in achieving that settled status. A big area it was in relation to children in care, particularly whilst we've sought to encourage our residents, actually local authorities have had a duty to ensure that our children and young people in care were supported. Well, we made applications on their behalf, and Children's Services worked very proactively to identify those children and young people, ensuring that applications were made for all 11. As you can see, that the status of that is that 6 have been granted, 1 for being processed, 1 refused. I can't, I'm afraid, due to sort of confidentiality, let this committee know any more details in relation to that case, other than the fact that the local authority is still in touch with it and supporting that young person, and continues to make representations to the Home Office on their behalf and with them. Like some of the details of that case are quite sensitive, so I can't tell you any more on that, I'm afraid. In relation to our workforce, we haven't experienced any significant workforce issues, perhaps because our workforce already had British nationality or have received sort of settled status and the right to work. We do have arrangements in place, however, for the future to ensure that we've got those sponsorship arrangements in place. So if there is a need or a particular candidate is required, we do have that sponsorship licence. So no particular impact on our workforce, but we were also worried about our supplier and contractor workforce. As you've sort of said in relation to COVID, we talked about that supplier and contractor workforce and also having that impact on us. Really hard, again, I'm sorry, to take the impact of COVID and Brexit apart here, because they're affecting the same areas as well. So we expected Brexit to impact construction, hospitality and care and retail, and they're exactly the same sectors, unfortunately, that are hit by COVID. So really difficult to isolate at the moment. In social care, we haven't seen any particular issues, but we think our understanding is that perhaps that it shares a workforce with retail. As retail closed, those retail workers looked elsewhere for employment opportunities and went into social care. So as those restrictions ease, we need to consider and monitor that impact. It may be that people go back to retail. It may be actually that they prefer to stay in care, and we don't know. So we'll have to watch that as that works through. The other areas in relation to sort of local authority duties are in trading standards. Trading standards proactively prepared for that and provide an advice service and information to our businesses. Similarly, the Economic Development Service has provided seminars, webinars, and may provide advice. Actually, to date, we haven't had an awful lot of requests for advice. I think in general, well, obviously people have been looking at COVID first, impacting their businesses. We've been giving more advice on COVID. So there's not been heavy amounts go through. The government have published a lot of information themselves, and we think that they're largely going there for information. This is just some of the information which we have had from the work that we have done with local businesses. Clearly, the first area was talking about a no deal Brexit, and that was May 2020. So yes. So, and then the other business network in July talked about some of those issues in recruitment and supply chains being disrupted. We also talked about the potential risk in relation to EU funding, and there are big EU structural programmes of funding. Now, Hammersmith and Fulham hadn't, in the last programme round, received any funding on that. In fact, most of those European regional development funds were provided through to the GLA, which administered it really on behalf of London. So London and therefore Hammersmith will have benefited from that EDRF funding through GLA programmes which look to support SMEs, look at energy efficiency, and look at skills and workforce. So whilst Hammersmith and Fulham wouldn't directly have received those funds, it was certainly coming in to support things in the borough. So whilst a UK shared prosperity fund will be welcome, the replacement for that, there are some concerns about that in relation to Hammersmith and Fulham. That the discussions at the moment very much and government policy points to levelling up. There is a current community renewal fund which has been sort of suggested as a pilot for the UK Shared Prosperity Fund that talks about different levels of priority for investing in areas. Hammersmith and Fulham, along with a lot of London, is low priority. So I don't think we will expect to benefit significantly, if at all, from the UK Shared Prosperity Fund. But again, the detail on that hasn't come out yet, so I'm just surmising there. Right, nearly done. A couple of other issues that we will have raised to you in terms of being risks, and just really saying that they're closed off now. Procurement obviously has changed. We've had relevant training, and we understand that the new procurement rules, I think we will see more come out in relation to procurement as the government sort of sees more independence in setting procurement rules. We were rather concerned about data protection and the ability for data to flow freely between suppliers. Actually, just very recently, just last month, the EU Commission did approve a data adequacy decision, which meant that they thought that our data protection laws and practices were sufficiently strong to protect the rights and freedoms of their data subjects, and therefore that could be. And of course, you would expect that to be the case, given that all of the legislation that was currently in place in the EU would have transitioned in to the UK before being amended. So I guess there may be some ability for them to review that over time, but the immediate risk has gone. So finally, I was sort of started apologetically saying I couldn't separate out the impact between Brexit and COVID to you, but as I was preparing this presentation, I read an FT article that was telling me that some of the most world-renowned economists were also struggling to assess the impact of Brexit, given the impact of COVID. So I didn't feel so bad after all. Very difficult to separate. We didn't, thankfully, see cost increases in relation to quotas or tariffs, but that's not saying we're not seeing cost increases come through. Not sort of a lot of detailed analysis to date, but anecdotally, particularly in construction, we're seeing, or capital, we're seeing issues in relation to workforce availability and material costs. As I say, part of that will be down to COVID, particularly isolation and other requirements. Part of it will be down to Brexit. Very difficult to say which parts which at the moment. But clearly for the local authority, a sort of wider economic downturn does provide us risks in relation to losses of revenue and also increases in demand for some of our services. So something that we will need to continue to look at. So that was a brief whiz through what the risks were, whether we've covered them off, and some of the things which are really just telling you that unfortunately we're going to have to just wait and see for the minute, but we'll keep monitoring.
Excellent. Thank you very much, Emily. And thank you for putting together the presentation. I know this is a very wide-ranging topic that covers all areas of the council. So thank you very much for covering all of that off. Councillor Schmidt, did you have anything you wanted to add?
No, I'll react to any questions. But yeah, very comprehensive from Emily.
Thank you very much. I'm reminded of a quote. There are no knowns, there are things we know that we know. There are unknown knowns, things that we don't know that we know. There are unknown unknowns, things that we don't know yet. And this and the fourth one that I've muddled up in my head. So it feels like this is a topic where, although we know perhaps slightly more in some areas than we did last time we looked at this back in 2019, there are other areas where it turns out we found out things that we don't know. So there's an awful lot going on and an awful lot of horizon scanning and research and indeed soul searching going on as we try and find the answers to this. There's just a couple of points I wanted to pick up on before I hand over to questions. The first one was something we covered last time, and I think something we covered earlier on. So forgive me for going over this, and something you mentioned in your presentation, and that is contractor workforce, specifically staff working in care homes. Now, as I understand, we've got 3 main care home providers working in the borough. Are we in communication with them? Are we speaking to them about what they think the staffing challenges are? It seems to me that, having watched the news for the last year and a bit, I'm not sure I'd be rushing out to get a job in a care home. How are they feeling about being able to adequately staff care homes, particularly bearing in mind demand in this area is only going to go up in the future?
Yeah, no, so you're right. I mean, we're actually having sort of very regular conversations with them because of the impact of COVID, but our conversations are focused mainly on COVID. I think just to clarify, you're absolutely right. We have relationships with a number of care homes, a small number of care homes. We don't have large numbers of people in residential care. Our largest sort of supplier really is in the home care market, and there are, as you just said, three home care providers, and that would be an area that potentially has used EU residents. As we said, we've been pretty successful in that EU settlement scheme. So any local employees, we would hope will have gone through that scheme had they wished to stay in the UK. So that kind of immediate issue sort of has passed, plus, as we said, that sort of support that's coming through from what would have been the hospitality industry, that's sort of bolstering the employment market at the moment. I guess it remains to be seen. Obviously we would have had a constant flow of people coming through, and so it remains to be seen really as we go through how that will be. So definitely we're in regular conversation with providers at the moment, because they are experiencing issues with workforce, and as I think Councillor Coleman mentioned earlier, in relation to some of the support we're providing to ensure their staff can have sick pay and ensure they don't work when potentially ill. So yes, conversations are being had. Honestly, the conversation's focusing more on the COVID impact than the Brexit impact, but that will continue to evolve really as COVID dies off. Well, if it dies off.
Another known unknown. The other point I wanted to just bring up briefly at the beginning is this idea of replacing EU funding, and it is something you did comment on in the presentation. This funding stopped in 2023. 2023 is very rapidly coming down the tracks. We'll be there before we know it. And I think, like a lot of people, I'm quite concerned that the central government's current definition of which areas need money are which areas vote for Tory MPs. I know that we do get certain key bits of funding. As I understand it, so adult education and environmental areas are certainly some of the sources. We get funds to deal with these sort of issues. Have we calculated what the loss would be if these aren't replaced, and what the impact would be of having to continue meeting those funding needs?
So I think that's right. We have raised the potential issue of adult education before, because there was European money essentially going through the GLA and then out again. Our current expectation is actually that will continue as it does now. So there isn't expected to be any loss in the adult education. But you are right. There was some EU funding that fed through there. I think linked to that is the sort of employment skills money, which would have been provided through that EU structural funds, but on a London-wide basis. So it's Councillor Vincent may know more than me actually, but it's coordinated by the LEP. So that was it was sort of some money that went into research projects, often and sort of cross London impacts. So there is no sort of direct loss of funding that Hammersmith and Fulham will suffer. It will be that more sort of indirect loss, and the lack of the it's not the ability to submit bids for future funding. We will be able to submit bids for future funding. It's the likelihood of success of those, given the levelling up agenda, that will be a concern. So no direct loss, I guess, given that all of that money was very much on sort of economic regen, and that's the kind of money and focus that you need coming out of a global pandemic. That's really where we would really have wanted to see that investment go in, and the fact that may not go proportionately to London is a concern to us.
Thank you very much. Councillor Schmidt, do you have anything you want to add on either of those points? No. Okay, I'll open up to the committee for any further questions. Does anyone have anything else they'd like to ask? Councillor Cooper.
If no one else is, can I be allowed a highly speculative question that Emily is perfectly at liberty to answer, unknown to, but given that it's the hospitality industry that at the moment seems to have been the most impacted, and I suppose given that we just don't know about how future patterns of work are going to work themselves out, how dependent is the borough's economy on that commuting workforce coming into offices in the borough, and thence on the hospitality industry within that? And I mean, obviously we just don't know what's going to happen to it. I'm just kind of obviously, somewhere like Westminster is highly dependent on that trade, and we will be less so. I'm just trying to kind of establish how much less so, how much of a risk factor is it to the future economy of the borough?
I think it's probably an unknown, or certainly an unknown for me. I think our economic development department may have a better idea than I do. My understanding, certainly from our business rates base, is a vast majority of our business rates base is around retail rather than hospitality. I think that I'm sure there will have been people commuting into Hammersmith. They're certainly not all local in terms of the businesses that are larger businesses. Having said that, I expect we also sent a lot of our people, our residents, out to other areas who are now able to buy their lunch in Hammersmith. Of course, they might be buying their lunch, making a sandwich rather than going out to a shop, but that may change over time. So I'm not clear that we're heavily reliant on that hospitality. Again, Councillor Vincent may know more than me, and I could maybe try to ask our economic development team to give us a little bit more information on that.
Sorry, thank you. I mean, I realise that was a highly speculative question, but it's sort of something that just has fascinated me about how London is going to change and which bits of London are going to win and which bits are going to lose. And I'm sort of just praying that Hammersmith and Fulham is on the positive rather than the negative.
When you look at the planning pipeline and approvals that were granted over recent years, sort of before Brexit and before the full extent of how severe the form of Brexit the government was going to pursue was, a lot of that was in office space in Hammersmith and Shepherd's Bush, White City, as how it's described. So that is certainly at risk in terms of the impacts of these combined impacts of Brexit and COVID. And a lot of hospitality that was coming into those two town centres was very mindful of trying to attract people who can be working in those offices. And we need to see how working habits change and need to see how many of our European neighbours may have left during this last 18 months, which would be, very sad in terms of the what makes Hammersmith and Fulham special, but also economically really negative. But it's obviously too early for us to tell. Some of the indicators that we'd look to see how the hospitality industry is faring, a big one would be business rates, but those business rates, they haven't had to pay. One of the good things government did was step in very early and say business rates and hospitality was going to be covered by government, and it was too early for us to see hopefully coming out of the pandemic, which of those businesses will actually survive once they have to pay for all these things, as we discussed in the COVID paper.
Thanks, Matt.
As Emily said, we're a strange borough because we have an enormous amount of people who commute out of the borough to work in the city and so on, usually a lot of professionals and so on, and we have an awful lot of people who commute into work because it's too expensive for them to live here. And so arguably there is a set-off there in terms of the people who don't come in and therefore spend their money for a lunch here will be offset by the people at the moment who aren't going to the city. Although people are starting to trickle back in, trickle is the right word. And so I think eventually they will fill up again. L'Oreal and Disney and all the other ones will fill up, and we'll be going back eventually to Shortlands, I imagine. So it would, but we don't know how long it's going to take.
I guess the question is around this combined COVID Brexit impact. You could say the same about the impact it has on the city, and will people need to go into the office in the city, or will there be jobs for them to go to in the city? And if not, if they don't need to go in the office or there aren't the jobs, what's the point of them living in Hammersmith and Fulham? Some of them might say, why don't they move to Europe if the jobs have gone there, or out of London if they want to change their lifestyle because they don't need to commute into the city. So there's a lot of these unknown factors that are really it's very difficult to separate COVID and Brexit from them.
And the other point is that maybe there's an argument that cheaper office space in places like Hammersmith with good communications will be used by people rather than places in the city. So why go and spend money in Canary Wharf or the city when you can get it for not quite half the price? It's actually not quite expensive, but a lot less than you would pay out there if you can get some decent space in Hammersmith somewhere, or Shepherd's Bush or Fulham.
Not necessarily cheap, but definitely good value, I think, is what we'd say.
And the new developments on that basis.
I think that the industrial strategy, which is looked at mainly in the economy PAC, but was developed and sort of refined very much with this in mind, aware of the risk that Brexit posed. So saying, well, what can we do to try and mitigate it? How can we attract, using the fact that office space here is cheaper than central London, but we have the asset of Imperial and all that means in terms of ideas being spun off from the very clever people working at Imperial. How can we try and harness that so that we can withstand the otherwise negative pressures that Brexit might bring by making this still an attractive place for people to have a business, despite Brexit and now despite COVID. So hopefully the industrial strategy will be mitigating what would otherwise potentially be a more negative situation.
Thank you, Doug. Thank you very much. Do we have any? Does anyone else have any questions? In which case, do you mind if I come back in? Perhaps on a connected but separate topic. Thank you very much for the information about trading standards and business support. It seems like there's an awful lot of very good work going on here in the borough to try and make sure that people are as prepared as people running businesses are as prepared as possible for the changes that will come as a result of Brexit. There are a couple of points that did sort of trouble me, I suppose. The point about xenophobic abuse for businesses run by EU nationals. Is this something we've seen examples of?
I'm not clear that we have seen examples. I'm just going to get to that part of the slide. I think it was just that it was a concern. So it wasn't that we'd actually seen that. There was a concern that might happen, given following the sort of experience that some European and other ethnic minority backgrounds had after the referendum vote. So yes, you're right. They did say they were anxious about a fear of racist or xenophobic abuse or violence because they've seen increases in attacks post-referendum. I don't know that we have particularly seen or noticed that continued increase or impact on business. Not something I think when talking to the economic development team, that they thought that it had played out. It was just something that was causing anxiety for those businesses at the time back in May.
Thank you very much. That's reassuring. So the other thing was the evidence of people running businesses saying that they were having difficulty with recruitment. I was wondering if there's any more that we could be doing, perhaps in linking up school leavers, people who come to the council who are in financial hardship, who may not have a job but may want to work, linking them up with these vacancies. There's a great charity in my ward, the Upper Room. I'll give them a plug. They provide employment support for homeless people, people who've got a wealth of experience, who could provide a great deal to employers, to society as a whole, and they give them the training and support that they need to apply for jobs. I'm sure they'd be delighted if there was some sort of list of people who were desperately short of workers. Is there some sort of matchmaking service we could set up, I suppose, between those looking for work and those who are able and willing to do it?
I'm sure, yes. I mean, that certainly is one of the focuses of the economic development service. So absolutely, they are looking to support employment and skills, certainly doing a lot very recently on apprenticeships that would look to support people in providing training into the hospitality sector. As we said, the other particular sector is retail, and I know we do a lot of work there. Having said that, I'm sure there's always more we can do, Councillor V, and I didn't just note the name of the charity you said, because I will put them in touch. It may be that we already have dealings with them, and the economic development team do. So I don't know whether you want to email me or give them another plug, and I'll write it down. And
absolutely, always happy to plug the Upper Room. I'll send you their details. The base
okay. I know we do a lot of work with people at risk of homelessness with the charity Beam, which they may well be aware of. So definitely something that we are doing, and we in looking at that support, we look at the businesses within the borough to see how to best provide the right or support people in getting the right skills. But certainly I'll pass that one on.
Excellent, thank you very much. Any other members of the committee like to jump in with a question? In which case, thank you very much, Emily and Councillor Schmidt, for coming to present on this item. As I mentioned earlier, it's a very wide-ranging item, so thank you very much for pulling all this information together for us. It's really been helpful. I think, like the COVID item beforehand, we have learnt more than we knew before, but there still are some of those known unknowns and unknown unknowns out there. So I'm sure this is something that will come up again before too long. So thank you very much, and thank you very much to everyone who has joined us at the committee. The date of the next meeting is the 15th of November, so I'm sure I'll see you all then, and you'll mark that in your diaries and wait with anticipation. Thank you very much for your time, and I hope to see you again soon.